All right, here we are again with another episode of the Active Health Podcast, where we're going to talk all things health, fitness, and performance, and we believe in taking an active role in your health. Today's going to be a much different conversation. Today we have Robert Karrick with us. Karrick. Robert Karrick. I always mispronounce your damn name.
It's okay.
Now, man, so anyway, he has been a longtime patient and a fun patient, and the reason I wanted to choose him for our first patient to be on here is because every single time he comes in, we end up just talking for way too long, and I fall behind. But so thanks for coming, man.
Yeah, thanks for having me.
How are things going today?
They're going.
Good.
Yeah.
What you got going on today?
This.
Yeah.
And then here this afternoon, me and a friend are going up to Minnesota. Cool. We're going to go watch the Wild play.
Like the hockey team.
Mm-hmm.
So
it's gonna be
is that the Iowa Wild?
Minnesota Wild, like the NHL.
Oh, see, yeah. I'm not familiar with hockey.
It's going to be so fun.
It's a playoff game then, because we're in playoff season. Mm-hmm. Are they good this year?
Won. Well, they won yesterday.
So they're up in the series.
Mm-hmm. They're doing pretty good.
And who are they playing?
I knew you were going to ask that.
It doesn't matter because you're.
It doesn't matter. It's going to be electric in there.
Are you a Wild fan?
I'm a hockey fan. I haven't followed it in a long time.
Did you play hockey?
Mm-mm. I had a couple buddies that did.
Yeah.
Yeah. My high school, I did football.
Right.
And but our high school didn't sponsor a hockey team. So if you wanted to play hockey, you either went to the other school or you kind of sponsor yourself.
Right. Remind me again, where are you from?
I went to high school in Illinois, Rochester. Cool.
And then did you go to college?
I did 2 years.
2 years,
yeah.
Okay. So you played football. Did you play any other sports in high school?
Not in high school. I did soccer and football growing up. Yeah.
Soccer. You do not look like a soccer player.
Mm-mm.
No.
Everything changed.
Yeah.
Yeah. And they kind of gave me a choice. Like, you can either play soccer and just be second or third string football, or you can choose.
Right.
So
your high school pretty competitive then?
Oh, yeah. Especially now. Like, way more now than it ever was when I was there.
Yeah. Yeah, I was fortunate here in small town Iowa. I was able, and even there are some schools in Iowa that you can't do this, but I was able to play all the sports.
Oh yeah.
I played baseball, football, wrestled a couple years. The football coaches make you run track, and I hated that. That was a trauma in my life. I was not fast, and they make you run track, and
I never realized when I came up here that wrestling was so huge in Iowa.
Oh man, I mean, wrestling is like. It's God's country, and like that's what everyone does. And I couldn't love it more. I was a wrestler from like fourth grade, and there's one of my biggest regrets is I didn't finish high school. I went out my junior year and didn't finish my junior year, and then didn't go out my senior year. That's one of my biggest regrets ever was not finishing. But I just love wrestling as a sport. It like encompasses like everything, like as far as hard work, like it's just you, no excuses. Like it's just you against another individual. I like team sports and all of that too. But like wrestling just encompasses all that. I guess that's maybe why my favorite sport right now is rugby. I didn't even play rugby till college. And then, my boys are playing rugby now cause it's kind of a new sport in the high school level. But what I love about rugby, to me, it's like the mix between football and wrestling. I don't know have you played rugby? Did you play rugby? It's like the way the game goes is you have to have your team. And it's obviously physical, but like you can't play without your team in rugby. Like I feel like in football, you can be the star receiver and go out and make this amazing catch or whatever. But in rugby, like you can't play the game without your team. And so like it's even like you go into a tackle or they call it a ruck, and you have to have the team ready there to support you. And you're always using the words like support and like to coach and yell at the team. So it's I don't know. I just love rugby for that reason.
Pretty cool.
But yeah, wrestling is huge in Iowa. So you didn't wrestle at all. Mm-mm. Even from Illinois. Mm-hmm. Oh, crazy.
They had it.
Yeah.
I worked.
Mm-hmm. Yeah.
Yeah. I couldn't do everything.
Right.
So I had to go to work.
Yeah. That's funny. But anyway, I have to share this with you guys because one reason that I just love him is his personality is because of this picture right here. I gotta show you guys this. So this is a picture from our electronic health record. This picture right here. So just so you know, with our electronic health record, when people come into the office, we like to obviously create their whole file, and we like to have a picture of them. So like there's some verification. We want to make sure we're not creating fraud, and so they give us our ID. But anyway, it's good for us just to know we can identify faces. And so when we took these, the girls were taking pictures of patients, to put into their file. And he grabbed the iPad and said, "Here, I'll take it because selfies are better." And then he gives us this damn picture, like just like the biggest smile. biggest energy. And so I get to see that every single time he's on the schedule or coming in. So it's a warning for us. It's awesome. I love it. But no, it's been fun treating you over the last 4 years. When did you, so I know we've been able to help you with several different things, but like, when did you have some major injuries in athletics, or was it just later in life?
So, football, I probably hit people with my face mask and helmet, but I never really, when you're 18 like that, like you
Don't even think about it.
You don't really think about it. So then later on, I joined the military and overseas, there's some stuff that happens, some events.
Yep.
So, feet, knees, back, neck, for sure, which is what we'll probably get into.
Right. Yeah.
And it's just over time, I think, like, because I'd recover and everything. And then here I am, I'm 35, and all that stuff's coming back to haunt me now.
And that's so common as far as no matter who you are, is when you're, we'll call it 18 to 25, you live life and you might get injured, but you recover so quickly, you don't even notice it. And it's always the 10 years later that you start to notice things. And when you're in a situation like you, where just the nature of who you were and the nature of what you were doing was a constant stress. The environment you were in, but then, rocking and carrying the loads that you had to carry on your feet all the time with those, awesome boots that you were given to wear all the time.
Sometimes. Inserts in.
Sometimes. Yeah. But it's just, it's a recipe for there's going to be problems later. And that's kind of why it's, why hopefully we have some health care for people afterwards. So you started experiencing some of those aches and pains, but at that age, like you said, you weren't feeling too much. And now here you are, 35. And what was the initial problem you came into us for? I forget now. Was it just back pain?
I think it was just some back pain and neck pain.
Yeah.
And which is like I try to make sure that I get in at least once a month just for maintenance and stuff.
Sure.
Yeah.
And then I feel like maybe, was it your feet that were kind of like a real big issue for you? That was the first thing that we really had to dive into. And
the first thing we dove into, this was actually pretty recent. And I don't know what was going on. I think I was just training hard for something.
Yeah.
And so I was running a lot, but I was also on my feet a lot at work and on my feet a lot at home. And I was doing a lot of projects at home, just carrying stuff up and down I'm trying to finish my basement, carrying stuff up and down the basement. And it just felt like my feet were just constantly in pain.
Right. And that probably does stem back, way back. And feet are so many times, it's just a cumulative issue. It's very rarely our feet like a one-time, I was on my feet too long this one day type of thing. It's usually cumulative over time. And you definitely had the history for that. And so you were doing the running on your feet, and you like to lift pretty heavy from time to time. And so if I remember like when you were doing your deadlifts and stuff, it really, at least we talked about that a lot as far as, trying to work with your feet in those positions.
Tying in better with the feet.
But so you had the horrible foot pain. If I remember right, what I love about treating patients like you is you were really receptive to not only the care that we provided and would, made your appointments, but you also would ask, okay, what can I do for myself at home? What are the things I can change? And so just to kind of outline what you were doing, you just had we call it plantar fasciitis. It's a generic term for, pain on the bottom of the foot. Typically it's cumulative in nature, meaning it's something that slowly over time, and you get a breakdown potentially of the arch of your foot. There's 3 different arches in your foot. Like if I'm using my hand as an arch, we all know is that, the big arch here, but you actually have the dome going over the other side and then a smaller arch on the outside. And over time, because of trauma, because of repetitive use, those arches will start to fail a little bit. And when they fail, they put tons of stress on the fascia and the layers of tissue on the bottom of the foot. And when you got that constant stress, it causes we call them repetitive sprain strain injuries. So little micro traumas to the tear of the fascia down there. And over, it builds up some scar tissue and things like that. So to treat it, we want to be able to clear up that scar tissue that's between the layers, but then also help train the foot to kind of get back into that arch. And that was a lot of the things that we worked with you on. Is if I remember right, I dug in on your feet a lot, and it hurts because the foot's painful, and we're putting some pressure and moving tissues and trying to break up that scar tissue, and we used some laser. But the important part, and you worked on this at home, was kind of trying to build that arch, and we talked some exercises like that. And you worked hard at it, and it took a couple months, but but your feet got quite a bit better.
It was about 8 weeks.
Yeah,
right?
yeah. Going through that, I mean, had you, maybe you didn't even ask anyone else. Did you, was your first provider to even ask about your foot pain? Had you seen anyone else for it?
Mm-mm.
No. So
I usually just come here,
right.
which we've talked about before.
Yeah.
And I suppose I could say it here.
Yeah.
Like I recently had to reestablish care with my family medicine doctor, which nothing against him. He's great. He's in town. Really good dude. I just, if I've got a cold, I'll take some cold medicine or drink some tea. And, but if I have an injury like this, I just come here.
Right.
And I told him that same thing, and he thought he's like, man, Rob, I don't really have anything to say.
Well, and
it's like, if it's working, then it's working.
Yeah. And I think, thank you for that. But I think, a lot of the family medicine docs are going to tell you that is they're not equipped per se, and they're not in the business of treating musculoskeletal conditions like that. I mean, honestly, the best thing he would have done is he probably would have given you, a prescription for ibuprofen and referred you to physical therapy, which essentially that's kind of, we didn't use the ibuprofen, but essentially that's kind of what we did. Yeah. So that's perfectly fine. But no, it's always interesting that people will go to their family doctor for, things like back and neck pain, and it's just conversely, like, it's interesting to me, like what are their expectations out of their family doctor for things like that? I mean, they literally are armed with a pad of paper to write a referral or to write a prescription. I mean, literally, most of those family docs can't really do much.
I feel you're almost, you're just extending the timing.
Yeah, yeah.
Like, go to my family doctor so that he can recommend a chiropractor,
right,
or physical therapy. Where I can just go to a chiropractor that I go to.
And over the time, I've told patients this a lot. That's what I love about what I get to do is when a patient comes to me, I actually get to be active in treating it. Like I grab onto the tissue and treat it. So if it's my personality, awesome to be able to just actually help someone with that rather than make the referral. Which we need the other part too, but like it's for me, I just love to be able to do that.
Right. So I was just saying, just with the hands-on thing, when I told you about my foot thing, could you tell by feel?
Yeah, and sometimes it's super obvious, and in your case it was. Sometimes it's not. Sometimes we do base some of our treatments off symptoms. They even tell us in school, 80% of our diagnosis can come just from the patient explaining their problem. And then obviously we try to fill in the gaps of the other 20% with different tests and things like that. But in your case, and actually a test in this case is touching the tissue, feeling it, and you can feel the tightness in the tissue. You can feel, because I've been doing it for so long, when I grab it and I move, say, your toes, and I can feel that the layers of the tissues are sticking together rather than just gliding separately. So in this case, we could tell and feel. And, as a chiropractor, when we're literally palpating and touching and feeling tissues all day long, we do get pretty good about identifying things even with our hands, but motion is big to us too. And so like you didn't have, say, per se fallen arches, but you could tell that your arch wasn't quite as strong as it once was. And so the combination of the texture of the tissue and then seeing your arch fall, and then obviously the big 80%, elephant in the room is you said I had foot pain right there. Right.
Right. It's right here.
So that absolutely helps. But yeah. So you can, in some circumstances you can tell, and a lot of times we're treating the spine and everything. Literally that's like you come in for your maintenance adjustment and you tell us, kind of where your aches or pains are, but then we obviously feel the whole spine every time and we're feeling for different things. So yeah. But yeah, that's kind of how it goes on trying to figure things out. It can be that basic, but lately we've been working on your neck. Yeah.
You got an X-ray.
Yes. It's interesting to me. And I actually loved kind of going through this process. Just last week, we kind of went through that process. So you've been struggling with a lot of neck pain for quite a while.
Yes.
And it comes along with headaches. A lot of tension in the neck and shoulders. Pretty classic as far as neck pain goes. But it's trying to, the thing that everyone always wants to do is identify, well, why and where did it come from? And again, it's kind of like being a detective. We just kind of broke down, utilizing kind of, talking about some of the different traumas you've had over the years, whether it be whiplash type traumas or things like that. And then we took that x-ray, and the x-ray, what we were able to see on your x-ray, when we take an x-ray of someone's neck, they typically have what's called a forward or cervical lordosis. So it curves forward, kind of in that direction. And that's the side view of the x-ray. And, you had your x-rays, I think, from your family physician. We didn't take them here, I believe.
It's from the VA.
Yeah, from the VA. Yeah. And so he brought those in there. And, and what we were able to see on your x-ray is just the opposite almost. It wasn't like a full opposite, but it was past straight and almost curvature in the opposite direction. And so this is very common with people with neck pain, and especially the headaches and, the tension throughout the neck and shoulders, because as we talked, what that's indirectly causing is it, because the curve is naturally forward, but now it's going the opposite direction, a lot of the muscles on the back side of the neck, which travel through the neck, because of that position and that reversal in the curve, all of those muscles are just held in a little bit further distance. So they're just held in the top position, even when you feel like you're at rest. And so that holding the muscle in the top position is just stretching it ever so slightly all day long, 24 hours a day, 7 days a week, which makes the muscle fatigued. It makes it feel tension. And then the nerves that run through there get irritated and can cause the headaches and things like that. And so that's what's causing a lot of your pain.
Yeah, I feel it a lot, like in my traps.
Yeah.
In my neck, like around it.
Mm-hmm.
And it just always feels muscular.
Yeah.
Like tissue every time. And I'm constantly like just stretching all day long.
Yeah. And it's interesting that that's classic. It matches, again, like 80% of your diagnosis comes from the patient and what they're telling you. But B, that natural feeling to move. And I tell people all the time that's innate, what I call innate intelligence. Innate intelligence is something in chiropractic philosophy that we talk about a lot, as far as it's your body kind of knows what it wants. It knows what it needs, so you keep trying to do it. And in your case, the muscles they feel like they need stretched, even though they're being overstretched because they don't feel right. So you're just trying to get motion. But also your body knows it needs something. So a lot of times we'll have patients come in that are always trying to crack their own neck. It's because they need adjusted, right? And so hopefully if we can actually treat what's causing that, then innate intelligence says, well, I don't need to do that anymore. I don't need to try to adjust anymore. But yeah, it's so fun to be able to see that and reflect in people. Is like, I feel better when I do this. Well, let's do that and see if we can fix it that way.
Let's go look at that.
All right. But what was unique in your particular cases, we really want to try to figure out what the kind of the cause of the problem was, and is it something now that caused it, or is it something in the past that caused it? And that was kind of the detective process we went through and utilized the x-ray to do that a lot in your case. How we did that was kind of what we also noticed. We had the reversal of the curve, but the good news is all of the joint spaces between the vertebrae were pretty good, meaning the cushions, like those discs, the cushions that are in between each vertebrae were pretty decent. They weren't horrible, but we had that horrible reversal of curve. And so kind of what we deducted from that is the reversal doesn't happen overnight. So it's not something that happened recently, because the reversal of the curve takes some time and repetitive trauma to happen. And it wasn't one particular thing, because typically if it was a one particular instance, the trauma was so much that it would probably blow out a disc and probably create some degeneration right at one particular disc. In your case, it was pretty uniform throughout the whole neck, telling us it was probably, multiple traumas over multiple times. That kind of contributed to it. So that kind of helped us kind of make an opinion or a guesstimate of the potential mechanism of injury, which is interesting, kind of fits with what we were all thinking. Yeah. But we're still working on that. So,
yes.
I don't think
new.
It's not something, you're still living life.
Mm-hmm.
You still have...
Still working, still doing my thing.
Yeah. And so there's still traumas that are going on there, and you're still aging. And so, those things that happened 10 years ago are starting to surface.
Yeah. I'm curious. You worked on me for like 4 years. There's a little hiatus there. You recommended another doctor, and he was great too. He's from the area too, right? Nate.
Yeah.
So you both have very similar styles. And it was really great to go to him. And obviously when I came back, it was awesome. In this whole time frame, your manipulation of my neck and just all the work before this x-ray, I mean, did you think it was going to be something to that degree?
I knew because of I knew of your past traumas and that you had some neck pain. I knew that you would have at least a loss of the curve in your neck. I knew that you probably wouldn't have a forward curve. But I probably didn't suspect that the reversal would be as significant as it was.
Okay.
And honestly, I was probably surprised to see that you didn't have one like particular disc that was really bad.
That was a relief.
To
find out that
absolutely.
That's okay.
I mean, it much like your feet and working on that, with time and they're doing the right things, potentially improve this a little bit. But it'll probably be something that is a little bit nagging.
Probably.
That we're going to have to just kind of manage. I think we'll be able to get it settled down. Yeah. But no, I didn't anticipate the reversal of the curve to be quite as bad. And, I think, 4 or 5 years ago, you were, 30 years old, and I don't think you came in with a major problem. So I'm kind of surprised we didn't take an x-ray initially because it wasn't that bad. But no, I'm glad we got it now. Yeah. Well, I tell you, as far as, I think speak on, had you had anyone sit down with you with your x-ray and talk to you about it before?
That specific one?
Yeah.
No. After that x-ray happened, I could see it if I log in to the website, and I'm just, and there's a quick little report from whoever initially looked at it. Excuse me. And then I actually just got a phone call from the doctor that requested it. And I didn't say anything about what you said yet. I waited till he was finished. He talked about there being some arthritis. He talked about, he also mentioned the same thing with he's like, I see spurring but your discs still look okay. He didn't say anything about the shape,
sure,
of the curve thing. And so then I was like, okay, well, that's really interesting that you said that. And then I just mentioned a couple things that you said. And then we just had a really good conversation about
That's
it.
good. That's good.
It was all over the phone.
Yeah. That's actually really good. So that's better than most people get, to be honest with you. A lot of, a common complaint we get from patients is, they'll have providers take imaging and they don't ever get to see them, number one, hardly. And they don't actually get a really good explanation. So, I mean, I feel like in your case, you got pretty good care there as far as an explanation. Yeah. There's always going to be a difference of opinion on what's significant. And I think as chiropractors, we do think maybe slightly more globally than other providers. I think that the curve could have an effect. Even though there clearly is a normal cervical curve and an abnormal cervical curve. But I don't think all providers recognize the significance of the curves and how they change and the stresses they can put on different tissues. And it can be on both directly on the spinal cord too, or on the muscles that we've talked about extensively. So that you're always going to have that difference opinion. But the fact that you got that communication is actually pretty darn good.
Yeah. Connection's huge though. I remember when I was having the foot pain issues, I was babying one side over another sometimes. And then sure enough, my lower back on one of the sides would start hurting. I'm just like, man, I got to figure this out.
Right.
It's just the connection for your whole body. Is
and
interesting.
You're a good patient in that regard too, is that you can kind of put together the connection because you're using your body and you see that, hey, my foot is causing me to walk this way and now my back's hurting because of that. But that is our job to put the connection together. But a lot of patients wouldn't put that together. So that's very intuitive on you as well. So that's, applaud you for that. That's cool. But you're smart in some ways.
Oh, stop.
God.
You stop it.
So, so you got this wild game tonight.
Yeah, I'm super excited. We're gonna go down a little early. We're probably gonna get something to eat.
Sure.
Might stop and check out a distillery or two.
Yeah, you absolutely should. I mean, you can't. I don't know if you can watch hockey without having a beer or two.
Something.
Something.
Yep.
That's super cool.
Yeah, I'm super excited about it.
Yeah. Well, man, I appreciate you being on the episode, and I hope this is just a very comfortable conversation, and that you can see the interaction of how we look at people differently, how we try to identify and look at the whole story and try to get to the bottom of the issue for people. This isn't meant to be any grand explanation of anything. This is just how we treat people. and it's just fun to be able to have good people that we treat, that have conditions that we want to help them through. And we did give a gift for you today, so you can. I pulled this from Sean Ryan that he gives all episode participants a gift.
Yeah.
I don't feel like you got to open it now, but
Okay.
that'd be a token of our appreciation.
Shout out to your staff for sure.
Our staff, they are incredible, and
they make a big difference when you come in.
they do. Thank you for that. And
Not just me. Like
Yeah.
I see how they treat everybody, so it's pretty fun.
yeah, thank you for that.
Good environment.
Thank you again for being on the show, man. Have fun
you.
tonight.
Yep, we'll do.
Yep, and we're out.
That was fun.
Yeah.
We could do that another time. We don't even have to talk about this.
Yes. No, absolutely.